Natural and home remedies for Melena. Melena is also known as black stool. Melena is blood in the stool that is black, tarry, sticky, and smelly. The blood in Melena comes from high up in the gastrointestinal tract, and gets partially digested, which is why it changes to Melena. Blood in stools condition is normally referred to, in medical terms, as Melena. To distinguish between the causes of Melena, associated complaints, if present, are taken into account, which usually determines the area of involvement resulting in Melena. Esophageal or upper gastrointestinal causes of Melena. Blood in stools can be commonly present in gastric or duodenal ulcers. With the stressful life people lead nowadays, this seems to be the most common cause. Esophagitis, or commonly known as inflammation of food pipe, also results in bleeding in stools. Stress, eating of oily and spicy foods. History of taking any medications, especially over-the-counter medicines like aspirin and other painkillers, or persons who are on steroids. History of regular intake of alcohol. Excessive smoking and use of betel leaves and tobacco. Intestinal causes of blood in stools. Amoebic dysentery, or commonly known as food poisoning, can also lead to blood in stools. Other condition called as ulcerative colitis also leads to bleeding. It can be associated with mild to moderate abdominal pain with cramps and with mild fever. Intestinal worms can also cause blood in stools. Common causes being eating food in unhygienic conditions, unwashed vegetables, etc. before cooking, eating stale food. Anal lesions causes. Fissure in ano, a condition in which the anal mucosa gets cracked resulting in bleeding. Anal fissure is mostly caused by chronic constipation or hard stools. Hemorrhoids or piles, which results in bleeding in stools. Other causes of Melena. Previous history of jaundice. Previous history of typhoid fever. Cancer of gastric mucosa. Abdominal couches or tuberculosis. These conditions require thorough investigations. The above causes mentioned are most common and observed in day-to-day life. Treatment and preventive measures change according to the causes of blood in stools. A basic line of home remedies to soothe the gastrointestinal tract which will help in prevention of Melena is recommended below. For prevention of blood in stool. Take plenty of green vegetables and fibrous food regularly with fruits and juices. Use wholemeal flour, avoid refined ones. Avoid fried items, hot and spicy food. Drink a glass of water in the morning. Try to establish regular bowel habits and always answer nature's call promptly. Avoid excessive intake of tea and coffee. Stop smoking and drinking alcohol. Avoid anxiety and worry. Home remedies for blood in stool. To avoid constipation. Mix in equal quantities, dried ginger powder and senna leaves powder. Take 5 grams of this powder along with a cup of lukewarm water before going to bed. This helps in easy passage of stools. For bleeding piles. Poultice made of sesame seeds can be applied over bleeding piles as an external measure, and half of teaspoon of sesame seeds with little butter can be taken orally. Buttermilk mixed with little bit of black pepper powder and salt should be taken daily for a few months. Crush about 11 rose petals with 50 milliliters of water and take for 3 days on empty stomach. Ginger and senna, take some dried ginger powder and dry senna leaves powder. Take a glass of lukewarm water and mix 5 grams of the mixture. Drink this before going to bed. Buttermilk, add some salt and black pepper in a glass of buttermilk and then drink it. Take this combination daily till the problem is cured. Sesame seeds, eating half a teaspoon of sesame seeds with little amount of butter is a good home remedy for blood in stool. Rose petals, ground 10 rose petals with half a cup of water and take it for 3 days on an empty stomach. This is also a good home remedy for blood in stool or hemorrhoids. Diet for preventing blood in stool. Fiber-rich diet. To avoid chronic constipation, the diet must be rich in fiber. so increase your intake of green vegetables, fruits, etc. Water. Drink 1 liter of water as the first thing in the morning. This helps to clear the stomach. Melena is black and tarry. It may also have a foul smell. The color is caused by the oxidation of the iron in the blood as it goes through the digestive system. The black color is usually an indication of a bleed in the upper GI tract. For this reason, melena is often indicative of bleeding in the stomach or in the small intestines. It could also be indicative of slow bleeding in the lower GI. Fresh blood in the stool is an indication of bleeding in the lower GI or in the rectum and sigmoid colon. There are a number of causes of melena stools, but the main thing is that it is caused by hemorrhage somewhere in the GI tract, usually in the upper portion. The possible causes of melena include peptic ulcer disease, gastrointestinal cancer, ingestion of blood. This can result from trauma or from bleeding in the mouth or in the oral and pharyngeal areas, including nosebleeds. Overdose from anticoagulants. Hemorrhagic blood diseases, for example hemophilia. Melena may also occur in newborns around 2 or 3 days after birth. This is mostly due to swallowing blood from the mother. Most of the time, melena is not considered a medical emergency because the bleed is slow. Here are possible treatments. Coagulants. Antibacterial drugs, for Helicobacter pylori that causes ulcers. Antacids.